Hello, everyone. A very, very warm good afternoon to you all. My name is Dr. Gauri Kulkarni. I head the medical operations at MediBuddy, and today we are bringing you the whole month as a series for Women's Day celebration. We all know women, all of you out there, are an integral part in our all daily lives that we all live together and form a form a very close knit association with people around us, our families, our personal and professional lives. And it's important that we all make health our number one priority. And with that in mind, from MediBuddy, what we have decided is that we'll bring you a series of webinars which will take care of the most common issues that people bring in regarding their health, women bring in regarding their health. And today we'll be talking about skin care. I think that's a very common issue women face, and they all have a lot of questions around it. And it's a good idea that we discuss about skincare. And if you have any questions, please feel free to ask them so that I can take them up through the session, right? So let's begin first by kind of understanding, right, why skincare important, right? A very common phrase, right? Beauty is only skin deep. It's a very commonly said phrase. But we also know it's what's inside that counts, right? And when we say inside, it means that another way of looking at it is how our skin looks has to do a lot with what is inside of us, or what our complete or whole health is, which is also reflected out on our skin, right? So it's important for us to understand that skin health should be major focus for all of us, because skin is not just about the look, or the way we look on our face or our skin, but it also has a lot of important function. We all know that skin is the largest organ in our body, right? It is it is the first line of defense for all of us. So it prevents any any microorganisms or any bacteria to come inside, right? Because from it protects us from any invasion from any bacteria or microorganisms, or even say any hazards, chemical hazards as well, anything which is dangerous. So skin is a barrier and a protective layer for all of us. It also is, because skin carries a lot of nerve cells, nerve endings, and it's flush with blood supply. It also is important in terms of understanding pain, understanding temperature. So if something touches you and it is painful, you quickly retreat from it, or if it is a hot environment, you quickly retrieve from it. So skin helps us to understand our environment better because of its ample nerve supply, as well as blood supply, right? Skin also is very important for a specific synthesis of a specific vitamin D, right? It is only when the sunlight is absorbed through the skin is when vitamin D is synthesized in our body. So skin is important in many ways. It also is a reflection of many a times health issues that may be happening inside our body, right? For example, certain diseases may present with skin related problems. For example, certain autoimmune diseases will give some kind of a specific rash, which which wants you to get consulted with a doctor. Or say, for example, the color of the skin changes in certain health conditions. For example, it becomes yellow in jaundice, right, where the liver is affected. So we have to understand that skin also alerts us of any other internal health problems as well. So with that understanding, we all know that skin health is important, and we need to take care of our skin so that it helps us not only to look good, but also in keeping keeping healthy in a holistic manner, right? So let's go one by one in understanding, what are those things that we can do to keep our skin healthy, right? So let us go first with the basic skin care, right? The basic skin regimen, right? Before we go ahead into specific skin health related problems and then the solutions to it, right? So number one, right? We usually say, you should wash your skin, have a bath or wash your face. And yes, it is important because it being the first line of defense, it gets subjected to sunlight, to dust and dirt and microorganisms, so many things. But it is important to understand how do we do it, right? So we usually recommend people to say wash their face maybe twice a day or have a bath every day, but ensure that you have a bath with lukewarm water, right? When you have a bath with very hot water, it actually dehydrates your skin, which means your skin becomes drier, right? So best is that you cleanse yourself or have a bath once a day and wash your face maybe twice a day with a mild cleanser. Cleanser means any mild soap that you may use, right? Try to avoid irritating the skin by use of any shard products, right? A lot of people tend to use scrubs which have very sharp or very hard scrub or exfoliating agents. So avoid doing that because they actually irritate and cause micro abrasions on the skin and make it even more uneven, and it irritates the skin, right? So that's number one, right? How do we kind of cleanse or clean our skin, right? The next thing is to understand that what do we do or what do we give our skin, right? So number one, as we said, hydration. I think hydration is key. Ensuring that you drink lots of water and helps the skin to keep moisturized. It remains soft and supple. So drinking ample amount of water is important. Now a lot of people ask, how much water is enough, right? So we usually say anything between 2.5 to about 3.5 liters of water is good, right? However, this kind of changes. Your water needs change with a lot of things, right? So suppose it's very hot outside, you may require more water intake, whereas if the weather is cold, then maybe your requirement is a little lesser. But on an average for an adult, we say about 2.5 to about 3.5 liters is enough, right? Now water could also mean, sometimes a lot of people say, oh, drinking water is boring. So we usually tell people that, have you could have flavored water, you could put mint and cucumber in water, or maybe lemon, or anything which helps you to maybe add taste to your water is good, right? Usually I tell people that fluids which are or liquids which don't come under the so-called fluid intake is tea, coffee, aerated drinks, and alcohol, right? These four are something that we tell everyone to avoid from a health perspective as well as from skincare perspective, because they tend to again cause more dehydration, right? So having a lot of water, I think, is the next important thing for healthy skin, right? Now, naturally, skin is a reflection of what you eat as well, right? Having a healthy, balanced diet, ensuring that you have a lot of vegetables and fruits in your diet, which means it will give you a lot of vitamins and minerals, help your skin health as well. Specifically, say vitamin C is again very important for skin health. Vitamin E is very important for skin health. So ensuring that you have them in your diet is important. Like any other organ, right? Proteins are requirement for building. The proteins are building blocks for all your cells in your body. So having a diet which is protein rich also helps your skin in ensuring that the new skin generation, because skin is one organ where the upper layer gets shed and there is a new layer of skin. You're always getting a newer layer of skin which is formed, right? So for that you have to ensure that you have enough protein in your diet to help the skin regeneration. At the same time, having, ensuring that in your diet you cut down on your simple carbohydrates, right? Simple carbohydrates are things which are like processed sugar or anything which is like a pre-packed food which has simple carbohydrates. They tend to affect your skin health because the amount of sugar that you ingest will suddenly cause an insulin spike, and that causes inflammation all over your body, affecting the skin as well. So we typically we say that in certain skin conditions we specifically ask individuals to reduce their intake of simple carbohydrates, like if you have acne or if you have eczemas, because this can also and also it is known to contribute to premature aging of skin. So it's important that you avoid simple carbohydrates. So these are a few things that you can do from a diet perspective. So we talked about washing, we talked about diet. The next step is definitely sunlight. Like there's a lot of debate on should I be going out in the sunlight because my doctor told me that vitamin D is important. As a doctor, I would also say that yes, vitamin D is important, right? So you need to get sunlight for at least 30 to 40 minutes every day. However, you need to avoid intense sunlight exposure, right? So that is something that you need to avoid from a skin health perspective. So using or blocking sun damage by use of sunscreens, or wearing protective clothes, wearing a hat, wearing protective clothes will definitely help in reducing your skin damage because of sunlight, right? So that is one thing that you should be following. Also, because we all know that the UVA light rays that that fall on our skin tend to again damage both layers. So if you know a little bit about skin, right? So that there is something called as epidermis and dermis. There are different layers of skin, and the UVA rays can penetrate all the way down into the dermis, and that can affect the structure of the cell as well if this is happening over a prolonged period of time, right? So skin, if it is exposed to sunlight and especially to UV rays, it can damage the skin, it can age the skin. A lot of times people who have been in sunlight for a really prolonged period of time, they tend to have freckles, they develop dark patches, what we call as melasma. So it's a good idea that we avoid intense sunlight exposure and use protective mechanisms to keep away or block the sunlight and the damage that it can cause, right? Next is definitely exercise, right? There is no two ways about it. It's very interesting, right? And people a lot of times ask, how can exercise help in skin health, right? How is that going to happen? But we have to understand that when you exercise, two things happen, right? One is that the blood circulation in the whole body increases, and there is oxygen supply, which is also increased to the whole body, right? When blood circulation increases and becomes better, and there is better oxygen, which is circulating in the blood, it helps every part of your body, including skin, right? It helps in skin regeneration. It helps in increasing the suppleness and of the skin. So exercising definitely helps in improving the quality of skin over a period of time. So it's important that you incorporate exercise into your daily routine, not just for skin health, but also for a holistic care of health in all different levels, right? Next is getting enough sleep. We always call getting beauty sleep, right? So ensuring that you get your good night's sleep is extremely important for skin health, because night is the time when a lot of metabolic activities happen, right? When you are sleeping, a lot of new cells are formed, new work is happening in the body, in your sleep. And it's important that you rest yourself to ensure that you're allowing the body to regenerate and recuperate from the day's hard work that it has done, right? So it's important that you get a good night's sleep. Last but not the least, right? We have to understand that though there might be no direct relationship between stress and skin health, individuals who have skin related conditions, right? Like, for example, eczema, okay? They tend to show, or even psoriasis for that matter, they tend to show exacerbation or worsening of their skin health when they are stressed, right? So if you're somebody who already has a skin health problem, right, be it eczema, psoriasis, acne, it's important that you look at your stress levels. And if you are feeling stress, it is important that you reach out and seek help regarding it with a mental health professional, right? So these are some of the holistic care that you need to take from a lifestyle perspective for your skin health. But there's a lot of things that you can do, primarily focused to your skin health, which I would want to now talk about, right? You know, it's interesting to note that, you know, all of you must be in different age groups. Maybe you're in your 20s or 30s or 40s or even older than that. The skin changes in its appearance, in its texture, as the decades pass, right? As you grow old, the skin itself changes in its form. It's important to know this. And hence, it's important for us to figure out what we need to do as our age is changing, right? It's important for us to understand that, right? A few things. If you are somebody who is, say, in your 20s, you're a young person, right? It's important for you to understand that this is the ideal time to start with like a skincare routine. You need to adopt good, healthy skin habits, right? It's important. This is the time to start it, right? So one is that you have to start with your healthcare, you know, from a lifestyle perspective. You should start your changes, you know, be it in your diet or, you know, incorporating exercise, you know, taking care of your stress levels, sleeping well. You know, those are the things that you should definitely incorporate from now, from in your early 20s, because this is the time that you can bring in behavioral changes as well. But apart from that, from a skincare perspective, you need to bring in certain kind of a routine in your regular you know, day-to-day life that you should be doing, right? Now, what are these things that you can bring in, right? So one is that one is definitely, as I said, washing, right? So washing your face maybe twice a day, using a very mild cleanser or a mild, you know, mild soap to clean your skin, and also ensuring that you use in when you're going out in intense sunlight, to use a sunscreen. I think these two things, as a young individual, you should start in your 20s itself, right? Apart from that, when in terms of dietary perspective, once you start adding nutritious food, be it, say, rich in vitamins, you know, when we spoke about vitamin C, we spoke about vitamin E. But apart from that, you can also use topical products, you know, which you can apply on your skin, which could be vitamin C based serums, which also help you in your skin rejuvenation. That is something that you can definitely add on to your regular skincare routine, right? Also, I think it's important that you create a routine which is, you know, I say usually consistent, and which you can follow, right? I usually tell young individuals to avoid using very hard scrubs or too much of exfoliation, because usually when you're in your 20s, you have very soft and supple skin in most cases, right? So do not use any harsh products which will actually cause you abrasion on your skin, right? So that is what you need to do when you are young. Now, the young, I know most young individuals talk of acne as a problem, right? We all, we have all spoken about it, and a lot of people have that, right, as an issue. Now we need to understand that usually acne can happen to anyone, of course, right? But we also need to understand that usually when young individuals, right, young individuals who have acne, they usually have it because of hormonal issues, right? When there is when you're in your adolescence or you're just growing up, right, the androgens or testosterone levels, if they are high, they tend to open up your glands and pores, right, in your skin. And when these pores get clogged because of excess oil secretion, that is when you start getting acne, right? That is what it is. Most young people, we have seen that as they grow older, the acne reduces because the hormonal changes which are shown in the adolescent age groups usually comes down. Okay, but however, it depends. Some individuals also develop acne much later in life, like even in their 30s and 40s as well. There could be different reasons for it, but in young individuals, it is typically because of hormone related changes. Okay, now usually if you have acne, And if you go to your dermatologist, they will definitely, take your history. Many young women also have issues of polycystic ovarian syndrome. They have issues of thyroid problems, and they can add on to the acne or the skin related issues that the young individual might be having. So your when you go to your dermatologist, they will definitely do a couple of tests to find out if there are any other hormone related problems which could be contributing to your acne. And if yes, there might be a need to also visit a gynecologist. Now, in terms of treatment for acne itself, your doctor will give you a couple of different kinds of creams or things that you can apply, right, for yourself to help in healing the acne. There are a couple of things to it, right? So one is that the treatment is usually a combination of maybe a topical antibiotic because there could be an infection. It could be along with a benzoyl peroxide kind of a topical agent, and there could be some kind of retinoid that is given. So now this is depending on the stage or the type of acne that you may be having. Some people have very mild acne to severe acne where there are nodules and pustules which individual might be having. So it really depends on the type of acne one is having that the treatment is tailored. If somebody has very severe form of acne, then there might be need for oral medications also, oral tablets also that are given. But of course, that depends again on the diagnosis that the dermatologist makes and the discussion that you may have with the dermatologist to decide what is the best approach to acne. With of course, when the doctor diagnoses you with acne and starts you on a treatment regime, the doctor would also definitely talk to you about lifestyle changes in terms of healthy eating, about drinking a lot of water. I think these two things the doctor will definitely speak about. So it's important that you follow advice of the doctor when getting your treatment done for acne, right? So typically in the young adults, this is what we see usually. But having a routine in terms of ensuring that you're cleansing your face, you're using a sunscreen, moisturizing your face and body, is very, very important. In terms of just taking care, I'll take a couple of minutes to talk about moisturizing, right? There are different types of course, moisturizers, you will see, but typically the whole purpose of, moisturizing yourself is to ensure that the moisture which is already there in the skin, right, or the water content of the skin is not lost, right? So the whatever you apply on your skin is typically used as a barrier to not allow loss of moisture. So usually people think that if I'm going to apply a moisturizer, my skin will again become soft. It is not the moisturizer itself which is causing the softness of the skin, but it is the ability of the barrier created because of the moisturizer, which is holding the actual water content in the skin inside. So it's important that you drink a lot of water before you actually start applying the moisturizer, right? I hope you understand that, right? Most moisturizers are barriers, and hence it's important to understand why they are being used. So first, drink lots of water and then start using a barrier moisturizer. Okay, great. So I'm just having a quick glance because there are a couple of questions that are coming in. So before I go into the next decade where we are talking about, things which are which can happen, what you need to do as you grow older and go to the next decades. Let me see a quick glance at the questions. There's a question which says, just a few months back, I was hospitalized for asthmatic bronchitis and dengue in 2 consecutive months. I'm so sorry that happened. Soon, a month or 2 later, I lost most of my hair. I see. I now had to cut my whatever left over hair short. What could be the certain reason? Thank you for asking this question, right? A lot of individuals who have any illness, right, an acute bout of illness, right? What happens is our body has a unique mechanism to ensure that if there is a problem in some part of our body, see, be it you have an infection or you're going through a stressful situation in the body, it tends to shut down processes in other places, right? So that energies are used for your body to be able to cope with the current problem, or the current acute problem that is happening. So in your case, what happened, you unfortunately had dengue, which is an infection. You had asthmatic bronchitis, which means you might be, you may have to have even use inhalers and a lot of things, medications that you were on. So your body was trying to recover from this illness, right? During this time, what happens, that the body's mechanism to form new hair, new and grow new hair, stops. It's called temporarily, it stops, so that the energy is focused on recovery. And most individuals who have any kind of acute illnesses or a bout of illness tend to have what is called as hair fall, or a temporary loss of hair. Usually, once your energies are back, you're back to having good nutritious food, your hair loss is reversed, and over a period of 3 to 6 months, you will see that your hair is coming back again, right? So usually it gets back. But if you see that the hair fall is persistent or it is too much, it's a good idea for you to consult a dermatologist and quickly get a understanding as to could there be any other associated reasons for you to have a severe hair loss problem. Okay. What is the reason for significant hair loss in women? My age is 36 and I have significant hair loss issues. What is the reason for dark spots on skin? Right. So great, right? So hair loss, I agree. All of us like our mane, and we love to have long hair, many of us. But hair loss can be because of many issues, right? Some of the systemic issues could be just simple nutritional deficiencies. If you have anemia, that is a low iron or low B12 or folic acid, you are at a higher risk of hair fall, right? If you are having any hormonal problems, right, be it say polycystic ovaries or PCOS or thyroid problems or any other hormonal problems, you are at an increased risk of hair fall. There could be local problems, like if I have fungal infections or any kind of bacterial infection in the scalp, it can also lead to hair fall. So there could be multiple reasons why one could be having hair fall. Interestingly, hair fall has also been associated with stress, right? Or the kind of water that is available in your locality, right? So those could also be reasons for hair fall. So it's important to find out what is the exact reason in your case, right? So my suggestion to you would be that it's a good idea for you, if you've noticed significant hair fall, maybe it's a good idea for you to get to the doctor to find the reason for hair fall. And once you know the reason, then maybe we can get the reason treated. All right. If it is alopecia, which means male pattern or female pattern baldness, then I think it's important that this is usually diagnosed after excluding other possible treatable causes. And then there are certain treatment measures which are available, certain drugs which are available, which help in retarding the growth of, the fall of hair and improving the growth of hair as well. But I think it's important that you find the reason for hair fall before it can be treated well, right? What are the reasons for dark spots on the skin? Multiple reasons. It could be something which is natural, which is like freckles because of sunlight exposure. It could be dark spots because of scarring. It could be multiple reasons again. Usually I say that if you have freckles, there are certain medications that are available which can be used to reduce the darkening. But otherwise, it's important that you keep your skin healthy by, ensuring that you cleanse your skin properly, you moisturize your skin properly so that it helps in slowly fading away. Because most spots, if they are because of a reason like a scar, then not scar, but reasons like acne or because of freckles, then with the new skin coming up, these will usually fade out and reduce, right? However, if they are persistent, then you may need certain dermatological procedures to help in depigmentation, right? So let me I know I'm looking at a couple of questions here, but let me go back first and take care of women who are growing, in the older age group, right? So if you are somebody who is in the older age group, right, somebody who is about 40, right, naturally, aging is something that happens. Skin aging is something that will happen for everyone, right? As you grow old, your skin will age. Okay, so when your skin is aging, and how does that start? It's over. It is as with your body, every part of your body starts aging. Skin also would age at some point in time, right? So we have to understand that this is a process which will set in, right now, and hence it's important for us to know what we can do about retarding that process, right? So definitely ensuring that you take care of your skin, right? Anti-aging could imply protecting your skin from sunlight, covering yourself up, using large shades, or using a sunscreen before you step out, that those can be the things that you do. I think using moisturizing your skin is very important, because as you grow old, your skin becomes drier, and you will have fine lines and wrinkles. So it's important that you moisturize to trap the water which is in the skin, right? So so that it is more supple, right? So moisturize your skin, moisturize your lips as well. A lot of people forget that, you get now balms with sunscreen, so you can use them as well, right? Washing your face, be twice a day is important. Now, apart from using your lifestyle changes, which could be diet and exercise, and taking care of your skin, I think one of the things that I completely forgot and spoke about was smoking. If you're someone young and you're smoking, I think I always request people to stop smoking, because that actually affects and the aging process. It actually prematurely ages your skin. So if you're somebody who is a smoker, because tobacco, the toxins in the smoke will cause aging, and cause fine lines. It the skin loses its firmness and texture as well. It's a good idea that you stop smoking, right? Especially if you even if late, it's better to stop it whenever it is possible, right? Now, this is also the time that you have to see and keep an eye on, because this is the time when because the skin is aging, you will have more thinner and drier skin, and it becomes more itchy, can get irritated more commonly. So it's important that you also keep an eye on any kind of um, suspicious changes in the skin, right? Be it changes in the color, there is a lump or a bump, or a change in the way a mole is looking. It's important, because as you grow older, the risk of getting skin cancers also increases. So it's important that you keep watch on your skin, right? Are there any lumps or bumps? Is there any suspicious spot, or hyperpigmented spot that you're seeing on the skin? And if it is so, I think it's a good idea for you to get it checked with a dermatologist. And if it is something which is suspicious, they may ask you to get it tested with a biopsy or something. But it's a good idea, because as you grow older, the risk of skin cancer also increases. All right. So, I'm in the interest of time, I will again take a couple of questions, because I see them here. Little things that I can change or use in daily routine to keep hair on my head strong and for a long time. Absolutely. You can do a lot of things for your hair, right? So as I mentioned before as well, we need to first understand, why are we losing hair, right? That's the number one thing to understand, right? So the number one thing that we have to understand is that a common issue with women is nutritional deficiencies. So it could be, say, anemia, as simple as that. It could be iron deficiency, vitamin B12 deficiency. So if you are nutritionally deficient, it is going to affect your hair. Like everything else, hair is a protein. Having protein-rich diet is important. So ensure the first thing that is in your hand and very much possible to do is to just look at your diet, right? Diet is extremely important, because when you use the right things, or you have the right balanced approach to your diet, it will only help you in your skin and hair health. All right. So that's the number one thing that you can do, which is very much under your control. If you can incorporate a balanced approach to diet. Okay, that's number one. Number two that you can do for your hair health is also to get it periodically looked at, right? Which means if you have any local infections, if you have a lot of people have infections such as skin infections, in fungal infections, individuals may also have conditions such as, say, scalp psoriasis. So if you have anything that you see, there's a flaky skin on the scalp, or there is irritation of the scalp, get it checked immediately, because there could be something which is very much treatable and can be quickly taken care of. All right. That is something that you can do for your good hair, right? So third is definitely to take care of the hair. Now, so, getting, a lot of people use oil massages. It's a very common thing in India that we do, get a nice oil massage done. But we have to understand that when we are doing a massage, it is for the scalp and not for the hair, right? When you improve your scalp circulation, it only promotes hair growth. So ensure that you do that, right? I think I also usually recommend individuals to have, periodic, haircuts, because a lot of times, as your hair is growing, you will always have damage to your hair, right? Because you are out in the sun, you are out, there could be dust and dirt. So it's a good idea for you to have, periodic haircuts to ensure that the health of hair is maintained, right? Apart from that, for hair health also, we tell people, avoid smoking, drink more water, which is also very much under your control. When you're cleansing your hair also, it's important that you, wash your hair at least twice a week. But at the same time, also condition your hair so that it again traps the moisture in your hair to keep it, to keep it from getting drier and thinner. Right? So those are the few things that you can do from a hair health perspective. So there's a question which says, I have lines on my mid cheeks and open pores problem, and my hair is getting white in an early age. I'm a vegetarian. Please suggest me a proper diet. Uh, I'm so sorry that you are going through so much, and I'm presuming you are young, right? A lot of individuals do get premature graying, and this could be quite genetic as well for few people. And in that case, the more important thing about is to understand how we care about the health of the hair rather than the color of the hair, right? So that is something that you have to understand. Now, it's in terms of diet, if you are a vegetarian, it's great to know that you are. Now, I'm hoping that you have enough a balanced approach to your diet, which means you have fruits, about 3 to 4 portions of fruits every day, about 3 to 4 portions of vegetables every day. Along with that, ensuring that you have a high protein diet, as I was mentioning, So in terms of vegetarian diet, if you have your dals and pulses, if you have milk and milk products, they are high in protein. You can have soya, which is again high in protein. So have sprouts, again pulses. So these are the things, have food items which are high in protein, again with vitamins and minerals in the form of fruits and vegetables, definitely help you to keep your hair health better. Now, because you are, a vegetarian, you need to also, ensure that you limit your simple carb intake. So when you have too many simple carbohydrates, processed food, that also affects your hair and skin health. So kind of curtail on that. Most individuals who are vegetarian tend to have a carb heavy diet. So just ensure that you are cutting down on it and increasing your protein intake, right? So that is something that you can do. Now, if you do have a problem with your open pores, as you mentioned, it's important that the basics of ensuring that you are washing your face with a mild cleanser or a soap, twice a day, ensuring that you're moisturizing it and then toning it, right? I think toner helps to ensure that the pores are, the problem of pores are reduced. But if you do have it and it looks something which is not getting better, you should get to a dermatologist and talk to them to ensure that you get the right treatment if required. Okay. There's a question which says, my wife is having severe hair loss. Her blood glucose always comes fine with some deficiency of iron and vitamin D. She has major problem in crown area and head is quite visible due to less hair. Can you please guide? All right, right. I'm unsure of your wife's age, but it's nice to know that you're concerned about her, right? If she has any deficiency, of course, it needs to be corrected, right? So if she has an iron deficiency, ensure that it is getting corrected, go to the doctor and they will give you the supplement, get the vitamin D corrected. Of course, the kind of problem that you're mentioning is the crown area, right? So, which is typically what we call as androgenetic alopecia, which means that it's a male pattern kind of a baldness, right? So it is quite quite common, right? And women do face it. Then if you have it, right, first thing is that you should definitely go and consult with a dermatologist, because there are certain medicines, there is something called as, depending on if there's any infections, of course, they will treat it. But there are certain medicines such as minoxidil, which helps in, increasing or stimulating the growth of hair. To some extent, it can help, but it is not always sure. So you need to get it tested as to find out what kind of alopecia it is. If it is something which is of a temporary reason, then many a times it can respond very well to drugs like minoxidil. But if it is something which is because of, say, hormonal hair loss problem, such as androgenetic alopecia, then many a times these medicines may not help. So, but we have to see how over a period of the medicines that your doctor would give may last for anywhere between 6 months to 1 year to see how the changes are happening. And they should be looked at, used correctly as per directions by doctor. And if it doesn't work, unfortunately, well, sometimes we need to figure out what is the next step of action in terms of maybe using some, hair accessories to help with covering the baldness if it is more, right? So there's a question on, can we take fish oil supplements while breastfeeding? Yeah, it's good for skin and hair. Yes, fish oil supplements are good for skin and hair. And if you are a lactating mother, there should not be any reason why you can't take it. You can go ahead and take it if you want. However, definitely talk to your gynecologist, before you are taking any medication. I always say that, because we do not know what kind of, effect, the little one may have. But by itself, it is safe to take during, lactation. You can definitely take it. Please use it. It helps. I usually tell people that before you go for supplements, try to see if you can, add it into your dietary regime, right? If there's a possibility of having a diet which is, instead of having a supplement, if you can add fish into your meals, I would rather, appreciate that, right? So it's possible to kind of have a diet which is rich with all possible vitamins and minerals before you go ahead with having a supplement. But yes, you can go ahead and take it. Okay, so let's go ahead with a couple of other points that I was wanting to speak about, right? So we were talking about, skin aging, and we're talking about, as you grow older, what are the things that you need to do. So let me just give you basic tips. I think we have spoken about face washing, but I think it's important for us to, like, a lot of women tend to focus a lot on how they look on the face, I think, and it's all right to be concerned about how we look. But I would want to talk a little bit about, face washing, because I think a lot of people can sometimes be very aggressive with it. So one thing that we need to understand with washing faces, you need to be gentle with it, right? So don't use any soap or cleanser which is abrasive, right? Ideally, a lot of these products have alcohol as well, which can itself be dehydrating. To ensure that when you use a product, it doesn't have alcohol content and it is non-abrasive, right? When I say non-abrasive, which means it is not like a hard scrub. Don't use that, right? Always use, say, like a lukewarm water, instead of, don't use very hot water. Again, it dehydrates your skin. And whenever you're applying your mild soap or cleanser, it's usually use your hands, right? I've seen a lot of people who like use a soap, a sponge, or they use something else, right, which can again irritate the skin. They can use many people use a cloth or a sponge. Don't use that. I think using your clean hands is the best thing that you can do. Don't use scrubs. I usually don't recommend using scrubs. And always pat dry your face, right? I have seen a lot of people who are very aggressive and rub their face very fast. So just pat dry it so that you are not rubbing or causing any micro abrasions, right? And also, once you wash your face, I always tell people to moisturize, because then when you moisturize on damp skin, then the moisture kind of stays within, right? And it stays inside, and it keeps the skin supple for a longer period of time. Some individuals have the habit of washing their face very frequently, right? So of course, if your face is, if you've gone out in dirt and dust, and maybe a lot of, you've been exposed to it, then it makes sense to wash maybe a little more time. But usually I tell people to wash their face maybe once in the morning, once before going to bed. I think that is usually enough, right? Twice a day should be enough, unless you are in your work commands you, because you are in a place where it's very dusty and you're exposed to a lot of external environment, maybe it's microbes, or it could be anything, right, which is kind of affecting your skin. Then you may want to wash it more often, but otherwise, usually twice a day is more than enough, right? So great. So those are the few things that I wanted to discuss, in terms of skincare with all of you. It's important, it being a vital organ in our body, right? So it's not just about vanity of looking beautiful, but it's also about ensuring that we take care of a very, very important organ in our body, right? It serves a lot of purposes for us, and hence skincare is extremely important to ensure that we take care of a very vital organ, right? So I have a couple more minutes going, and I'm seeing a few more questions. So let me take those questions and then we can call it a day. There's a question which says, is hair serum necessary for frizzy hair? I use coffee exfoliator and after applying moisturizer, but my skin becomes too much oily, very much oily. So, okay, I hear that, right? So, see, you need to understand that depending on the skin type, again, right, we have to understand that things have to change according to the skin type that you have. Use of moisturizer also implies that you need to understand that you need to use a kind of moisturizer which will help you, right, which will help you to take care of your skin, right? So I think that essentially is the important aspect that we need to take into consideration. So see, certain moisturizers are only barrier moisturizers, right, which means they create a barrier to keep your skin soft. But then there are certain which help in actually hydrating, right? So now if your skin is oily, right, one is that you need to have a cleanser or a soap, right, a cleanser which will be able to remove that oily surface, right? So your cleanser needs to be for oily skin, and then once that is done, you need to moisturize yourself with a hydrating moisturizer, right? So the next time when you are, reading the small print of your, of the product that you're buying, I think, or when if you're meeting your doctor, you need to kind of discuss about the fact that if you have an oily skin, you need to have a cleanser which works with the oily skin, and then you need to have a hydrating moisturizer rather than a barrier moisturizer. So that is some difference that you need to kind of add on into your regime to help you with your oily skin. Now, in terms of exfoliation, right? Now, there are a lot of rights and wrongs about exfoliation as to what you use. I usually recommend to use, exfoliation as a measure only if it is necessary, right? So exfoliation, the exfoliation that you usually have is either the gel that you get with the, the scrubs that you get, or even the microdermabrasions that can be used, or there could be chemical exfoliations that happen, where you go to a what do you call to a dermatologist who gets it done for you, right? But it's important for you to understand that usually hard exfoliation only abrades the skin, right? So the product that you're using, if it has an exfoliation, it has an exfoliator where the scrub is very, very thick, it may actually cause more damage to your skin. Okay. So again, you need to go back and look at your product. I usually recommend that if you are picking up any products, talk to your dermatologist once as to what product they are using, and they will usually recommend you something based on your skin type, right? So if it's an exfoliator which has got very hard, scrub content, I would suggest not to use it in your case because it is causing more damage to your skin. All right. So great. I think I have taken up most of the questions. There's another question which says, is dandruff a hair problem? Okay. So dandruff is actually, usually it is a fungal infection, right, which affects the scalp. Okay. It's usually because of fungus, which causes dry, flaky, you must have seen white, dry, flaky powder or patches which fall off your hair, and that's usually a fungal infection. Usually if you go to a dermatologist, they will treat you with antifungal shampoos or creams that they will give you to apply on your scalp, not on your head, on your scalp, right? So you mentioned that you're using ketoconazole based shampoos. If it is not making any difference to you, then you need to again go back to your doctor, right? I'm sure that if you're using ketoconazole, that means it has been prescribed by the doctor. If that is not the case, then it could be something else. A lot of times, there is a condition called as psoriasis, which is an autoimmune disease, which also presents with flaky, dry scalps, and it is sometimes misdiagnosed as dandruff. So if you have not met a doctor and using ketoconazole on your own, then my suggestion is that you go and meet a doctor to find out what is the actual reason for the so-called flaking or dandruff that you're seeing. Okay. Is there any natural or near natural way to cover gray hair, right? My personal belief is if you have gray hair, flaunt it. But yes, it depends on everyone's choices. Natural hair, there's a lot of ways in which you can naturally color. There are a lot of natural dyes which are available. People use even beetroots, people use a lot of other natural dyes which are available to, color the hair. But I think it's a choice that everybody has. It's okay for you to not use hair colors, if that is something that is causing you reaction, it is best not to be used, in my opinion, right? Great. So I think we have kind of taken care of a lot of our questions, and we have spoken about skincare and skin health at length. To summarize, as I said, taking care of skin is important. It's a vital organ in our body. We cannot neglect our skin, and it's important that we look at skin from a holistic perspective. So be it taking care of ensuring you have balanced diet, to taking care of hydration and drinking lots of water, getting a good night's sleep, de-stressing yourself, It's also important that you take skincare as a part of your routine, which includes, cleansing and moisturizing and ensuring that you are protecting your skin from sunscreens, from sun by using sunscreens. And last but not the least, if there is any issue, right, if you see anything in the skin which is not responding, or it is something new, or it is troublesome, seek help at the right time, get to a doctor, talk to the doctor, and see if there is something that can be done. It's better to seek help early rather than waiting out with a problem before it gets too bad for you, right? So take care of yourself. I wish all of you a radiant and healthy skin. Keep smiling, stay happy and healthy. Until next time, let us catch up for the Women's Day series of webinars. So the next time, let us talk about a new topic. Until then,